Hi, I'm Dr. Mohan Rangaswamy. I'm a senior plastic surgeon at the American Academy of Cosmetic Surgery. Today I'm going to talk about a new procedure called composite breast augmentation. This is a combination of traditional breast augmentation with fat grafting of the breast. As you might know, breast can be augmented by fat as well as by implants. Each has its own advantage and disadvantage, but now the new trend is to combine the two of them together. Now basically, if we see this statue here and we use, for example, a breast implant, when we do a breast augmentation, the implant is very good at providing projections. It's also good at providing some upper pole fullness and is able to give strength and firmness to the breast. However, a breast implant used for augmentation does not do very well on the cleavage area. Sometimes it doesn't do the upper pole fullness very well, and if the woman has less tissue, then there's less tissue covering this implant. Sometimes that looks a little bit artificial. So these are the very situations when, if we do fat grafting as well, you can enhance the result and give a very natural appearance. For example, imagine that she has an implant. Now if she desires more cleavage here, then I can put fat graft selectively here, upper pole fat graft selectively there, and I can fat graft all around so that there is a look and feel of softness all around the implant. So this way the augmented breast looks more natural, and sometimes the implant cannot even be felt by hand. So this is very appealing. Now, is it scientifically proven? Yes, in the last few years, since this technique came on board, many cases have been done and it's been declared to be safe. Does it have any advantages? We think yes. There is some early result to suggest that capsule contraction is less if we do combination surgery. Of course, the combination surgery takes a bit longer. It's not for everybody. The ideal candidate is somebody who has small breasts but who has good amount of fat on her tummy or on her hips or on her thighs. So we can harvest the fat from there. That area also improves, by the way, and then we can augment the breast using implant and fat graft. Another criterion when we decide to do breast augmentation, and this is something that concerns the woman most, is what size breast implant is going to be used. Now there are various sizes, various projections, various volumes that are available. Unfortunately, women are thinking in terms of the bra size, and we are talking in terms of the volume of the implant. So the two do not match exactly. But let me tell you how we decide on what kind of size we choose for a particular woman. One of the parameters that we take into consideration is the width of the chest. So it's measured from the midline to the pectoral fold, and based on this measurement and the thickness of her own existing breast, we decide on what should be the base dimension of the proposed implant. And then we can measure based on this dimension. We get a choice of implants, and we then narrow down to a choice of 4 or 5 implants that seem to fit this base width. And then we take the other dimension, which is the projection that the woman desires. Some women do not want too much projected breasts, some want more cleavage. So accordingly we make a choice whether to use a high profile or a medium profile or a low profile implant. Generally speaking, if the chest is narrow, then we tend to use a higher profile, and if the chest is broad, we tend to use a medium profile. We also need to take into account her own thickness, because then that is subtracted from the base width in order to get the base dimension of the implant. It's easy to understand. If we put a very wide implant, for example, it will overflow. It will either cross the midline or it will overflow on this side. So sometimes women come with the idea that they want a significant augmentation of the breast, but after examining her, we have to tell her that you cannot take more than this size, because if we put a bigger implant, there is no space. So there are constraints based on the skeletal anatomy. And then comes the final choice, whether it is a round implant or anatomical shape. This implant has a little bit of a fall. Its maximum projection is in the lower 1/3, and it tapers upwards, and this is something similar to the natural flow of a breast. So if a woman has slightly sagging breast, then we can match this implant to the same shape as her breast, and the result will look more natural. Putting these factors together, we call this body logic system, and then we arrive at a narrow spectrum of implants that are suitable. Then we take models of those implants, we put them into her bra and let her see herself in front of a mirror. Generally, this is the way the consultation goes, and pretty soon we are able to arrive at one or two sizes that we think is the most appropriate for her. So once we have agreement between the doctor and the patient and her expectations, then we order those implants, and at surgery we do some trials and then choose which is the most appropriate for that patient.